Pelvic floor therapy can be a game changer for your health. It's also a very difficult topic to discuss. And when you finally get up the courage to talk to someone about this problem, how do you know if you're working with someone who's going to be the best person for your body? Will this person actually be able to help you, or will it cause more problems in the future? I'm Dr. Amy, PhD-trained orthopedic manual physical therapist, and I have a lot of women who come in here for pelvic floor physical therapy who have been to other clinics and not gotten the results that they were looking for. They really appreciate my approach and how I look at the pelvic floor as part of the whole body, because it is connected to everything else. The entire body is all connected. I don't believe in just treating the pelvic floor on its own, because if it's dysfunctional for a reason. It's trying to tell us something. So if this area is bothering you, causing you difficulty, which can be leaking with sneezing, coughing, or laughing, it may be constipation, it could equally be diarrhea, it could be pain with intimacy, or just a general desire to no longer have intimacy. And if those things are happening, your pelvic floor is trying to tell you something. If any of those things are happening to you, your pelvic floor is trying to tell you something. It is dysfunctional at this point. But the question remains is, what is the root cause of your pelvic floor dysfunction? Why did this area become dysfunctional in the first place? So when you're looking for a pelvic floor physical therapist, this should definitely be the starting point of your conversation, that they want to hear your entire journey and when you started to notice your pelvic floor dysfunction. Because for many women, as they look back, there may be some trauma, it may be some childbirth trauma, it may be some childhood trauma, but it could equally be a physical trauma in that they had some hip or knee or low back or SI joint problems in their past. That's now resulting in a pelvic floor dysfunction. You want to make sure that you have a real clear conversation with your specialist to ensure that all of these areas are going to be looked at during the evaluation to really come up with an understanding of how this started in the first place in order to create that plan to get you back to living a life you love. Now, another thing to look out for when you're choosing a specialist that I highly, highly recommend and talk about pretty regularly here on the channel is that if they recommend you do Kegel exercises to fix this problem, I would run, not walk away. Here's the reason why. One, it's hard to do Kegel exercises correctly, and many women struggle with that in the first place. But two, my guess is that your pelvic floor is not actually weak, but it's probably tight. And my guess is based on years and years of experience treating women with pelvic floor dysfunction and finding that for most of them, it wasn't a weakness issue, it was a tension issue. You see, when the muscles are tight, the muscle fibers are fully engaged. So then if you laugh, cough, or sneeze, let's say, and you say, oh, I gotta tighten up because I gotta hold that urine in, well, it can't. It's fully tightened. I'm giving it all I can, Captain. And so then if it's fully tightened and you don't do anything to relax it, and then you try to do a Kegel exercise, well, of course it's going to appear that it's weak because it's already fully contracted and it can't do anything else. And I get really, really frustrated when women are told that they have weak pelvic floors and they just need to do Kegel exercises. But my frustration has actually started to turn to anger as I meet more and more women who have been hooked up to biofeedback machines in order to fully assess and get objective measurements of their Kegel exercise. So I had one patient who came to see me who was actually in the Kaiser medical system. And so Kaiser does not allow you to see anybody outside of their system. But she wanted to get help right now, and her appointment with Kaiser wasn't for a month away. So we talked about this and we said, okay, we'll start pelvic floor therapy here. And then when it's getting to be time for that Kaiser appointment, we'll decide if that's the best option for you. Now, she did amazing. So her story is that she had her 4th child, and for the 2nd time, she had this happen with her 3rd child as well, she experienced a prolapse after birth. Now with her 3rd child, that prolapse went away fairly quickly on its own within a couple of weeks, but by the time she made it into my office, she was 3 weeks along with her prolapse, and her baby was 3 weeks old. And you can imagine being a mom with 3 toddlers and a newborn, and she had a prolapse that was so bad she actually had to kind of waddle along because she literally felt like her organs were going to fall out. It was pretty intense. She couldn't take her kids even to the neighborhood park because she felt like her organs were going to fall out on the way. It was really stressful. It was really difficult, as well as the fact that she now has 4 children to care for. So you can imagine this woman's got a lot going on. So the cool thing was, because she started therapy so early on in her journey, that prolapse actually resolved pretty quickly. I only saw her for 4 visits before she went to that Kaiser visit, and she was already able to walk to and from the park without experiencing any prolapse symptoms. Now, her next goal was to be able to go on a 3 or 4 mile walk and actually have that be exercise. So that's where we find ourselves when we had the conversation about going to Kaiser. So she asked me, do you feel like it's okay to transfer over? And I said, well, you're seeing a pelvic floor therapist, right? And she was like, yeah. And I was like, okay, why don't you go to the evaluation, see how you feel about working with them. We have 1 visit scheduled after that. We can tie up our loose ends here if you want to transfer your care there. And here's the critical thing, friends, and the thing that I will never forget. Before she left that day, after that 4th appointment, before she went to Kaiser, she asked me, do you think it will hurt me to go to this appointment? And I said, no. If you're seeing a pelvic floor therapist, they won't hurt you. Well, friends, I have a pit in my stomach as I'm telling you this story because she did end up getting hurt. So if you're familiar with Kaiser, you know it's a really big campus. You have to park really far away. And so she's walking into her appointment totally normal, no prolapse, no problems. In fact, she said it was like a 1/4 mile. She was a little concerned that it might prolapse by the time she got there, but no, there was no problems. So then they went to do the evaluation. They hooked her up to the biofeedback machine and had her do about 5 billion Kegel exercises and hold them for long periods of time. As soon as she was done, she stood up to put her clothes on, and her prolapse was back 100% the way it was before we even started treatment. She waddled to the car and was crying the entire time. She got home, she tried to do the exercises I had taught her, but they were no longer effective because of the prolapse. And a couple days later, she's in my office crying, telling me, I should have never gone there. I made a big mistake and I am not leaving you. I'm hoping you can help me again. Well, you guys, I felt horrible because I told her that they wouldn't be able to hurt her, but I did not think that someone who was that close postpartum, who had a history of prolapse, would be forced to do Kegel exercises for an hour. I didn't think that that was possibly a thing. But it prompted me to make this video because I am seeing this more and more. There are a lot of female PTs who are coming out of PT school and are really interested in pelvic floor physical therapy, which is fantastic. I 100% am so excited that women's health and women's health topics are making their way out into the mainstream. The fact that our bodies are different than male bodies, the fact that our bodies need to be treated than male bodies, I am 100% on board about that, and I am so excited. However, the downside of that is that many of them have only been trained in how to use biofeedback machines and do Kegel exercises. And Kegel exercises do not work. I just finished telling you the story about my patient who her prolapse came back after doing an hour's worth of Kegel exercises. But friends, I have many more stories than this. And it is at this point in my career, 25 years in, that I'm going to declare, if you have a pelvic floor physical therapist, a doula, a doctor, or someone who tells you to do Kegel exercises for whatever reason, please don't do the Kegel exercises, and please find somebody else who can help you. Because this person is not actually thinking about what's going on with your body. They're just going along with what everybody's doing. They're not asking themselves, is this pelvic floor actually weak, or even feeling the pelvic floor to see if there's muscle tension that needs to be relieved before doing any form of exercises. And I get that this goes against the common narrative. I get that you may have had a great experience with a pelvic floor physical therapist and you did Kegel exercises, and I am so happy for you. I am so grateful that that is your truth. This video is for people who have been let down by specialist physical therapists, doctors, and doulas who have told them to do Kegel exercises. This video is for the people who have been frustrated that they were told to do Kegel exercises and not given any other opportunities to help improve their pelvic floor health. And my guess is, if you're still watching, that chances are that that is you. Or perhaps you are a pelvic floor physical therapist and you've been watching to this point and you said, yes, I know she's right, but I don't know what else to do. Then I want to talk to you. We are looking for pelvic floor physical therapists who will help empower women with changing bodies to live pain-free. And that includes a complete assessment, not just of the pelvic floor, but of all the other structures that feed into that. If that sounds interesting to you, please send me your resume and cover letter to Dr. Amy, that's DRAMY, at pt4eb.com. And if you are a woman who has been told to do Kegel exercises and they did not work for you, and you are struggling with urinary leakage, you are struggling with constipation or diarrhea, you have pain with intimacy, then I'm going to include a link here of my favorite exercise to do instead of Kegel exercises. The reason why I like this exercise so much is that it activates the deep hip internal and external rotators. And you see, the pelvic floor is like a sling, but it is not very muscly or fleshy. However, the deep hip internal and external rotators are muscly and fleshy. So we can activate those deep hip internal and external rotators in order to get a passive contraction and relaxation of the pelvic floor. This helps to relax the pelvic floor as well as strengthen the pelvic floor at the same time. Plus, it's way easier to know if you're doing it correctly as opposed to Kegel exercises. So go check it out here.